man, they're not going somewhere. No, straight to the gate.
Oh, the enemy. The enemy not there.
Go straight to the digital x-ray. You say this is a shorter way? Yeah, because if I don't want it to pass, I need to check straight. Yes. Where do you hear, sir? Two stories?
It symbolizes strong, safer Jamaica. I urge all members of the community to continue working alongside law enforcement to create a society where families can strive in peace and security with the leadership
and secondary care, you know, primary care is not left out of this because the vital signs monitors will be shared with both sides of the family, and so we feel well included and we say thank you, thank you, thank you. And then on the soil, lubrious atmosphere, because this is a wonderful, momentous occasion of celebrating positive, progressive partnerships. Have a great afternoon. Yes, and we changed it up on Minister. He's been here many times before, and it's the first time him see it set up like this. Yes, man. So now switch up the thing, and it looking good. Yes, man. We have our caterers in the wing, and so at some of the things that can help to make our job easier, and we can focus on the unavoidable situations. Let me thank you. You have invested in us big time. And we truly, truly thank you. We appreciate you. And we are committed to using that which we have been given to offer greater compassionate care where we can decrease the demand. I'm asking you, brethren and friends, colleagues, let's work together.
Minister, can we just have one quick photo up?
Dr. Marcia Graham.
Overlay. Lenin Palmont. I will ask her if there's anything that excites her more. And she said, no, I just love machines. I said, oh my God.
This is beautiful.
It's beautiful. Okay, good. Sure, make sure we get to go ahead. Hold on, hey, don't invade the privacy of the patient.
1 second.
Wait. MP. What's up? Cool?
Demonstrate again.
Yeah. All right, tell us when we need to go in.
As soon as the portal gets on.
After the demonstration. So many.
I know who we are. Alright, so tell us now, you already
I'm Daisy Wallace. I'm manager for medical imaging service here at the Salomar Public General Hospital. State-of-the-art digital radiographic unit. And we have already started to see the difference that it's making in health delivery here just to give persons an idea of where we're coming from and why it is that we're so excited and over the moon. When I joined here, we were capturing X-ray scans on film. So we started off with film, and then we graduated to CR, or computerized radiography. That uses a cassette as well.
Right.
But it was very taxing on us because you have to do a lot of walking with these heavy cassettes. And the cassettes, those are what capture the images and displays it on a computer. So now we have reached maybe the MBA phase now, where we have graduated to DR, or digital radiography. Now the difference between digital radiography and computerized radiography is the way the X-ray image is captured. So the X-ray image is captured on computerized radiography on a plate, and we have to walk around with that. With this, it is captured directly on a digital detector, so it takes more time. The detectors are more sensitive to radiation, so the time that it takes for the image to be produced is significantly decreased. So once we make an X-ray exposure, within maybe 2 to 3 seconds, we can view the image. So you can imagine the difference it makes in the length that the patient stays within the department, inside the department. And also what it does is it generates the images, so you get quicker results, and therefore, quicker access to the scans. Doctor can.
So basically, tuffton high tech.
Very high tech, and we're very excited for that.
You're not sure the excited. You gotta be more excited.
All right, let me get you all excited. So what I would love to do is, yes.
The toys.
So, but see, the disadvantage of that is now I'm afraid that my staff will get so complacent.
Yeah, you don't
and
want to encourage.
so if you're required to lie for the X-ray, you go this side. If you're required to stand, you go here. That's the difference. All right, so I have a patient who, go back a little bit, this way. All right. So all I have to do is push on off. Of course, my patient will be out of the way, but safety is key. Awesome. Just like you see on Grey's Anatomy. Alright, so we can adjust, the patient will stand, and the radiation will be directed this way. And we adjust as is needed.
If you're just in a wheelchair, she didn't have to come up in a wheelchair.
Exactly,
Right.
exactly.
We have even done patients on stretchers, so we don't have to take them off
Can
the
you say
stretcher.
that over for
We just
video
need a
purposes?
patient.
You don't need to get out of the wheelchair.
Sure, if we have patients who are not ambulant, they can be done sitting in a wheelchair or lying on a stretcher, or even sitting up on the stretcher. So their scans can be done without removing them from their mode of transport.
Right.
So I have completed my scan here, and now I need to do some over this side. So, ta-da!
That's so much you did.
Of course, you alert the patient before you allow the unit to move,
Right.
because it can be scary.
Where is the machine coming at them?
It's awesome. The operator can also talk to the patient. There's a mic there, here.
So let me ask you a question now. I mean, in terms of maintenance, which is always a pet peeve of mine. And does servicing and maintenance is in place?
Servicing is a must, and that is guaranteed, and we're actually on a contract.
That's because I have mandated it.
Yes.
Yes.
And your job would be in jeopardy, CEO of this body. What about where the servicemen and women come from? Do they fly in, or they train some people locally for some of the basic servicing?
My understanding is that biomed-techs are trained locally to respond quite efficiently and
And I'm
quickly.
going to ask you kindly, and sorry to use you as the example of management, but make sure that that training takes place, because the people who handle sophisticated machines like this, sometimes we are tempted, or maybe out of ignorance, don't appreciate that that's been kept in a particular way, and you touch the wrong button, and all of a sudden what was digital becomes confusion, and that becomes a problem. So one of the things that we have to bear in mind, and I'm saying this to all in here, is that with the modernization of healthcare equipment has to come a transformation of how we manage the equipment. Because a lot of times we just don't manage our equipment properly. And indeed, a lot of the little fixes that are a nuisance that create downtime could have been avoided if there's routine maintenance that we take care of. And then of course there's the periodic significant maintenance and parts and so on. So I'm hoping that the contractor or the supplier have those arrangements in place, because that is the new dispensation, which means using the machines more frequently and more efficiently. The other thing that is worth noting is that given the pace and the efficiency of this, A&E hopefully will be less crowded, because we can get people in and out in terms of a quick assessment of what their conditions are and determine how to direct them. Because a lot of times when trauma cases come in and we don't know, people have to wait. And sometimes of this kind could say, listen, you don't need surgery, you don't need to be here, you can dress the wound and you can go home. So all of this adds up to a more efficient throughput of patients. You don't always have to build more space. What you need to do is get people in and out as quickly as possible. And this will aid that in a significant way. Thank you very much. I appreciate it.
Thank you too.
I don't know, I wouldn't even touch it, because this thing is anything I'm doing, you know what I'm saying? You just look for it and say pretty. Thanks about that.
Yes, sir. Yes, sir.
All right.
I'm sure it's possible. We have not ventured into that area.
Anyway, very nice, guys. Thanks a lot. We have a very high-tech generator outside, which will ensure consistency of power. So, Mr. CEO, you can just run a big long ball.
Minister, just 1 second. Let me get this picture. Look on. Right. 1, 2, 3.
All right.
Thank you.
All right.
Thank you.
Let's go look at it.
These are Cisco guys.
All right. Are you on the service one?
No.